Welcome to Passport Mommy. I'm your host, Michelle Jerson. This show is for anyone raising little humans. We feature experts with tips and advice to enrich the lives of our children. Mom and dad entrepreneurs tell us their inspiring stories. Learn about products that could make both you and your child's life easier and more fun. And of course, fellow parents discuss and laugh about what's happening in their child's world. Motherhood is a journey. Thanks for joining me on mine. I don't know about you, but during this whole pandemic, I really want to go away. I really want to go somewhere to have a change of scenery. And we have been mostly staying put. Our big day trip was we drove an hour and a half to Rhode Island. We're in Connecticut. And that was it. But I'm thinking, you know what? The perfect thing to do right about now is to go somewhere within driving distance and stay in a rental home, because you don't have to worry about hotels. You don't have to have the concerns that people are having during this time. So I'm thrilled to have with me today Melanie Fish. She is Vrbo's travel expert, and she speaks to people every day, to journalists daily, about the fastest growing segment in the travel industry, vacation home rentals. Melanie, thank you so much for being here today.
Thanks for having me. I'll tell you, it has been a wild time, hasn't it? And it's been really amazing how quickly families figured out that travel wasn't off limits completely to them. And they were able to figure that out by realizing, okay, we can get away, we can go somewhere within driving distance. And if we rent a whole home, we can maintain that social distancing that still makes us feel like we're getting away, but we're still staying safe.
Right, exactly. And then plus on top of that, with people's flexibility with work, with so many people working remotely, kids home from school, now they're off, but even when they were doing homeschooling, we have the ability to basically get in the car and go and stay wherever we want.
We saw this big uptick during the summer of people driving somewhere, booking kind of last minute getaways, just looking for a change of scenery. And so I was really curious, okay, well, what's going to happen when the traditional summer travel season ends and school supposedly is starting? I mean, this is hard for families to figure out, this hopefully temporary new normal. But what we're really seeing is a new fluidity in how families are vacationing for the rest of this year, at least. And we've dubbed it the flexcation. And that's what we're calling this trend, where families are booking vacation home trips for later in August, September, October. They're considering staying longer and mixing work and play. And then there's this really kind of surprise benefit to it, which is that they're able to take advantage of some price breaks that were reserved for people who could travel after the traditional busy summer travel season in this time that we call shoulder season, right after Labor Day.
And for those who have never done that before, because they're beholden to the school calendar or to work vacations, there are really some amazing things that you can see. I mean, you could take advantage of different times of year and different locations that are known for these things during times of year when maybe you can never travel in the past.
I don't think anyone is pretending, oh, this is great news, we can travel anytime. I think what families are doing are saying, wow, this is hard. How can we preserve our family's mental health? And okay, maybe find the possibilities here. And maybe that possibility is going somewhere that may have a Wi-Fi signal, so you can get a little bit of work done, but maybe you walk outside and that science lesson is picking up some shells on the beach in the evening. Or maybe it's not getting away. Maybe that's a luxury to get away for a longer stay, but you can maybe work with your schedule and go for a longer weekend and maybe go on a Friday through Monday instead of just a Saturday, Sunday getaway. So that's what I mean by flexcations, is that families are figuring out how to preserve their mental health, still get away, and get done what they need to take care of.
And what I do like about this is that if you have decided that within your own family, maybe your extended family, that it's okay to see each other, you can all gather in this vacation home and vacation together and have some time together as a family, which might not be the opportunity so many other times with everybody's varying work schedules.
Now, I did this summer. We have good friends who were taking this as seriously as we were, and we knew that they had really been on lockdown, as had we. And so we committed to that, and we did a joint getaway. And I know of 2 families with a combined, get this, 10 kids who are taking advantage of this idea of the flexcation, and they've booked a beautiful big home in Tahoe coming up where everyone can spread out a little bit. They're going to try to do a little bit of schoolwork during the day, but then also have hiking trails right outside so they can make the most of the situation and do it together. And I also, always that combining resources are a good way to take advantage of the space and value that vacation homes offer.
Let's say you are comparing a vacation home to a hotel. If you were thinking that that's an option for you, you still get so much more value when it comes to a vacation home.
The math has shown that you get about twice the space for half the cost of a hotel room when you rent a vacation home. And the value really comes when you're splitting that with another family. I personally was looking at this flexation idea, and I really wanted to get out of the heat and go to Maine. Well, that ended up being more than just a drivable destination for me. And then I looked at Colorado, and wow, the prices there are really reasonable in September, because you're not in the peak of the summer travel season, and you're also not in ski season. So I think there are some real opportunities here if you can work within this flexibility. And as a matter of fact, our research is showing that families want to do this. About half of the people surveyed said that, we're going to look at flexible school schedules as providing more flexibility in our travel schedule. And 48% of the people that we surveyed said, they can make their work schedule happen from anywhere too. And, those are the lucky people.
When it comes to staying at a vacation rental home, it seems to me safer than staying in a hotel. But what cleaning guidelines are in place for the homeowners to follow? Because you still might have a family that was there before you.
The nature of private vacation homes make them attractive to families. But what more can we do to make sure that the information is clear to them over what the homeowners are doing to make sure that the environment is clean? So we worked with health experts and came up with cleaning guidelines that follow recommendations from the CDC and other health authorities on how a place should be cleaned. We made sure those were communicated to the homeowners who list their properties on Vrbo. And then we immediately set up a way for them to let us know, okay, what exactly are they doing? Are they leaving a gap between stays? Are they committing to using disinfecting cleaners? Are they leaving cleaning supplies for their renters to do their own wipe down? And then we started adding that information to the vacation home listing. So you can, when you're looking for a place to stay, you know what the homeowner is doing. And just because it's not listed there on the site doesn't mean the place isn't clean. It just may mean they haven't responded to that question yet. So you can always ask that question of the owners. I sent an email this morning, as a matter of fact, to a house I'm staying in next week, to the owner to say, I'm just wondering if you're washing all the bedding, including the comforters, because that's something that's important to me anytime, not just in COVID times. I always ask that question. So we're adding more and more information to the listings, including cleanliness ratings from other travelers. But if you don't see the information that's going to make you feel comfortable, you can always ask.
What tools are Vrbo providing just to make it easy for us to book our flexcation, and where can we go to do this?
We talked about the cleanliness information that is recently highlighted on the property listings that you're looking at. Another thing I want to point out is the cancellation policies and the work that Vrbo is doing to highlight those. Because something we've seen during COVID is that a lot of people are experiencing vacation homes for the first time. So that means there's new awareness of the idea that Vrbo doesn't own the homes. Homeowners own the homes and list their places through Vrbo. So they set the policies and they set their own cancellation policies, and they can vary. So what Vrbo is doing is highlighting them and more homeowners are making those policies more flexible because goodness knows we all need to be more flexible these days. And so I would say the tip for travelers is to make sure you're aware of what the cancellation policy is and what the owner is and is not willing to do in case you have to cancel your trip, because things are still changing. So you need to be aware of that.
So give us all the websites where we can go to book our vacation home, because I know there are plenty of other people like me and you who are just itching to get away.
Vrbo.com. And then the Vrbo app I would really recommend. I mean, it's almost like a little travel Pinterest, just to go through the properties you like. And trip boards are a really valuable tool within Vrbo.com and the Vrbo app, where you can heart your favorite properties and save them. So maybe you're not sure how this flexication is going to work for you, and you just want to save interesting looking places within driving distance. You can create a trip board and call it Weekend Getaways and share it with the people that you're going to be traveling with, and people can vote for where they want to go or comment on the places that you might be staying. VRBO.com. Thank you so much, Melanie Fish, for joining me today. I'm Michelle Jertson, the Passport Mommy. You know, we have been so fortunate to have such great frontline workers during this time of the pandemic. And IBM Watson Health recently announced the Fortune IBM Watson Health 2020 100 Top Hospitals and 15 Top Health Systems, the award winners naming the top performing hospitals and health systems in the U.S. And today we have with us Ekta Punwani. She is the leader of IBM 100 Top Hospitals program, just to tell us all about these wonderful hospitals and to recognize them. Thank you so much for being here today.
Thank you, Michelle, for having me. I'm really excited to share this news with you.
Yes, absolutely. So tell me, why does IBM release a list of leading hospitals and health systems?
The biggest reason we do this, Michelle, is that we want to first and foremost celebrate these high-performing hospitals and health systems that are providing excellent patient care. We also, though, want to share the insights from these leading hospitals so that we can improve across the country our hospital and health system performance.
Right, exactly. And what factors do you consider when you compile the annual rankings?
Yeah, so we use a balanced scorecard. And what I always like to say is that we want to look at all the aspects of the organization. So we look at clinical outcomes, we look at operational outcomes, we look at patient experience, which is becoming more and more important. And we do look at financial health as well.
Okay. And I feel like this is really at the forefront now, especially because of everything that's going on, and people are really paying attention to this. What trends did you see while creating the list this time around?
Yeah, this time around, we are using, we're using data from the previous year, but what we're seeing more and more is that patient experience really matters. We expect to get safe and quality care when we go to hospitals and health systems, but what we're seeing is that hospitals and health systems are spending a lot of time making sure that patients are seen more holistically and they're getting that, really touchy-feely care, because that's really important when we're not feeling well.
Right, exactly. And I feel like, especially during this time, I've heard stories about people going into the hospital, not for COVID-related issues, that just haven't gotten the care necessarily that they really were hoping for or expected to get. And I understand the challenge.
Yeah, it's truly a challenging time, but these organizations have, healthcare workers have really, they are truly committed to providing excellent patient care, and they have sacrificed so much during this time. And we just really appreciate all their commitment and hard work right now.
Right. And what can hospitals use this list for? Like if they see the list and they say, okay, I was on the list, I wasn't on the list, how can they use this to better serve their patients?
Great question. So our study really provides great benchmarking tools for those hospitals and health systems. IBM Watson Health wants to partner with these organizations to support and encourage them to implement those best practices across their own organization.
Right. And so are you able to tell me a few of the hospitals that may have made the list around the country?
Oh, yeah, absolutely. Well, are you curious about where do you live? Where do you live, Michelle?
I personally am in Connecticut. I have family in New York and Florida.
Okay. So you got the East Coast. Yeah, there were, a number of hospitals on the East Coast, but even in Florida, we had, I think, 8 or 9 organizations that won. So I'll just give you a few examples. Doctors Hospitals of Sarasota was a winner. Palmetto General Hospital in Florida, Sarasota Memorial Hospital in Florida. So really, just a number of organizations. And what I really love about this study is that we have hospitals across the nation, and they're not all our large academic medical centers. They are small community hospitals, medium, half-size hospitals. And I think really what that demonstrates to me is that quality of care is really not defined, by the size of the hospital. You can receive exceptional care in many parts of the country. And I think that's really important for us to remember as potential patients or consumers of healthcare.
Yes, and that's an excellent point. And I'm so glad you brought that up, because I will say that I was visiting Sarasota a few years ago, and I was looking, I was like, wow, these hospitals are really small. And I wonder if the healthcare is good down here.
Yes. So and a lot of folks, feel that way. And I think this is where we've become much smarter as a consumer. And, this is a list, and we update this list every year. But as what I tell my family and friends is that it's important, no matter what you do, to do your research, before if you have the time to, before a major surgery or procedure or, any type of visit. It's important to do our research and to look at multiple data points to do that.
Absolutely. Well, Ekta Punwani, thank you so much for joining me today. I really appreciate it. I look forward to checking out the list. Where can people go for more information?
Sure. Well, first of all, Michelle, thanks so much for having me. And our listeners can go to ibm.com/Watson Health for more information.
Perfect. Thank you so much. I'm Michelle Jerson, the Passport Mommy. Don't forget, check us out on social at Passport Mommy. And if you're listening to this as a podcast, go ahead and leave a review. We'd really appreciate it. I always love having my good friend Marshall Stevenson on the show with me. He is a wonderful dad, New York City comic, the owner of the New York Beer and Brewery Tour. So he definitely has a lot of opinions about parenting, which I love. And Marshall, thank you for being here again, as always.
Don't you usually bring me on as an expert on parenting instead of that I just have a lot of opinions? But I
do. You are an expert with your own daughter. But you are.
Very good.
You are an expert.
No, you have real experts on, and you have me on for comic relief here. I wanted we have this great topic planned here, and I just wanted to ask you that my wife and I and 3-year-old went to the beach the other day, and we were concerned about using the bathroom. So I said, well, there's an easy answer to that. It's called the ocean. I mean, does anybody think the ocean can't be a toilet? So.
Oh, no, I taught Eden to do that the other week.
Great, right? Then you don't have to go in. Of course, COVID is, could be in the shared beach bathrooms. A lot of humidity, the toilets. We know that's an issue. So
right, exactly.
We don't want to use the beach bathroom. So I said, go in the ocean. But my wife thought the ocean was a little too choppy. And she said she got this wacky idea from our friend Michelle Jerson of what to do if you have a 3-year-old and you're not comfortable using a bathroom that's around you. What kind of wacky idea was this?
It was what I have been doing whenever we go somewhere, and I also don't want to use the bathroom, is I use my daughter's little portable potty.
No, you don't.
Yes, I do. I've used it. Let's see. We've gone hiking. I've used it in the parking lots where we've gone hiking. I've used it in many of parking lots. We did a road trip to Rhode Island. I used it on a sidewalk outside an ice cream shop. And I said to my husband, because that one I've never done it as public as there, it was at night. And I said, do you think like this can't be legal? And he says, I would love to see an officer come over here and ticket you for using your daughter's portable potty.
All right. Now, how he makes a good point. How visible was it? Like if you were walking by, it would have been obvious. Yeah, but I'm trying to get a visual. Did you have like a wide skirt just kind of around you because you were so close to the ground that the kind of skirt was just sort of created a big circle?
I mean, that time I was pretty visible. I guess it wasn't that crowded of a street. But when I first started doing this, I would take, say, the big beach blanket and I would put it around me. Or sometimes when we were at the beach the other week, I would open the passenger car door and then I would open the door behind where my daughter's car seat is. And then I would put the potty in between those two doors so that I would hope that the doors would kind of block people from seeing me. But it didn't block people from seeing me from the side or depending whatever angle you look at it. But I've tried to strategically do it. But then I realized, you know what? No one cares. I don't think anybody's looking. Like, I'm just going to do it. I'm going to wipe and I'm going to get up.
Wait a minute. There's the strangeness, and I applaud you 100% for doing it if nobody's looking. That's already a category that most people wouldn't go to. Most people would not take their kids' potties and pee on like the public street. Now you're saying you're escalating it even. You're making it even a more. My wife might actually do that, and she might have actually done it. But my wife would have gone like under the house. No way. What do you mean it doesn't matter in public? That takes it up like so many is this something? But I am just like, okay, a guy. I have a few, it's a little easier. You're on the Palisades Interstate Parkway. You could technically pee in the woods. I guess you could too. Wait a minute. Do you really did other parents? Did you get this idea from somewhere else?
No, I didn't. I forget where we were. when was the first time I did it? No, the first time was when we were going hiking and I saw the porta potties and I thought, I'm not doing that. And so I just thought, well, why not? That was the first time. Yeah, I just, but you mentioned that the other part, how you can go anywhere. If a woman is not comfortable doing the whole portable potty thing, they also make these things, which I took on my honeymoon to South Africa because I was pregnant at the time. And
you wanted to look sexy. I know where this is going.
This is going, right? So it makes your V into a P and you're able to go where you need to go. But I thought about that and I carry those in my car now too. But I'm like, you know what? I think that would be more obvious now than just doing a quick sit on the potty.
I guess the other one you could go to, you could, if there was a woman who was peeing on a tree, this day and age, I don't think anyone would mind that. I'm just surprised. Like, even that, like, if you are comfortable peeing outside an ice cream parlor, and that was more visible than all. So let's forget all the other examples because that was the least discreet of all of them. My goodness, You would have trouble facing a tree off a highway. You'd feel more comfortable on the sidewalk and people are actually noticing, well, anyway, I mean, This is bold. I have to say that my reaction is because it's very unusual. I approve of these things. I mean, hell, I'm sure there are a bunch of other people who are like, I guess we can't go to the beach.
Right. I mean, look, I had never thought to do it before COVID. It never had crossed my mind. But now I was like, well, what would I rather do? I have to go. So would I rather go to a public restroom or go wherever I need to go? And when you're doing outdoor activities like hiking and the beach and whatever, I feel like you could just find a place and go.
Okay, so next question. With this convenience, You've sold me. You sold me on how convenient it is. Let's say your daughter stopped using the potty because she got old enough. Now, I know you have another kid. Just pretend here. What if she were done using the potty and you had no reason to bring a potty with you other than your use of it? Would you bring the potty anyway for just you and not also her?
Well, if we're still in COVID times, I would still bring the potty and ask her to use it, because if I'm not going on the public bathroom, I don't want her to either. If we're not in COVID anymore, then probably not.
Right. I think this is great because you don't let things stop you. You know, I was looking up some glamping because I thought it would be cool. And they all have these camper toilets. And they're basically like a beautiful, nice, very glamorous, regular toilet seat with a bucket under it. And you basically put a bag there. You do your thing. You tie up the bag. You throw it in a discreet dumpster outside, and that's your plumbing. And that seems kind of civilized. That seemed all right.
Yeah, absolutely.
Sharing a bathroom with like a lot of other people seems not that good.
Right. Exactly. And, again, it goes with your comfort level. And so if your comfort level is not so high in COVID times of using a public restroom, then even if you feel iffy about sitting on your son or daughter's potty, you have to weigh that comfort level versus COVID bathroom comfort level. That's the way I look at it.
Two more questions.
Okay. Fire
would
away.
Would it be more strange visually if I had been on a potty outside the ice cream parlor, or you on a potty outside the ice cream parlor, or is this just we're grown-ups? I used to call them adults before I had a kid. We're grown-ups. It doesn't matter.
Yeah, I think male or female. I just think it looks funny.
Doesn't matter. Okay, well, anyway.
But then I thought, I was like, I wonder
question.
if I am sitting here, do people really know what I'm doing? Or could they think that I'm just kind of sitting down and not realize that there's a potty under me?
Well, that's the question. If you're doing it discreetly, it's strange. Using a potty when you're an adult is strange. I mean, the potty have flowers on it and you're like smiling ducks or something like
no, it's a pretty
part of it
plain
is weird. It's more weird. It's more weird if you think that people can see you. So when you said it was visible, I have another question.
Okay. I think we're going to save our other topic for next week. Come on.
The other question is, you were using the potty. You said it was kind of spontaneous. Like you hadn't planned to use the potty. So you were using the potty just because you were like, got to use the bathroom. Don't want to use that one. Wait a minute. Like a light bulb was above your head. Use the potty. Yes. Great. Yep. And I could see you as somebody who doesn't hesitate to these things. There not even being a moment of like, should I really? You were just like, potty. Awesome. Boom.
I was at first like, oh my gosh, who's looking? How can I be discreet about this?
But how can I be discreet about it? I'm not going to use this because that's not something people do in public. Like my wife and me also, it would have taken a long time of like, should I do this? Should I not? How bad left it go? How bad is COVID? Risk going to Portugal? There would have been that. You were just like, yes, go for it. Okay, second question.
Yeah, I think I did debate for a few seconds, but it was pretty much like, all right, I'm going.
All right. So if your daughter had been in diapers, would you have been like, I'm not going in that porta potty or the public restroom? Diapers. And put on put on her diaper.
Oh gosh. That hasn't crossed my mind yet. I think I would still go the potty route because you still need a place to change the diaper. I mean, I guess you could just go in your car and take it off. That's a good point.
No potty. I'm saying if this was if we were in COVID,
a pre-potty,
pre-potty, would you have had that moment where you've been like, should I do it? I don't want COVID.
Yeah, I don't know. I don't know if that thought would have crossed my mind. I'm not sure.
It It was not. That's not the right answer. Not the right answer. You would have said, I'm wearing a mask. I'm going in. You wouldn't have okay, maybe. There are people who, what was that woman who went cross country in a diaper so she saved time? Although that woman was insane. Who am I thinking of?
Right. So I also think that going potty in front of your toilet training child could be a good thing too, because then they're saying, oh, well, mommy could just go potty wherever. So I want to copy mommy. So maybe it could also be a lesson too.
I'm getting this is number 3. You've shocked me now a third time on the same subject. I am personally not actually pooping on a potty in front of my daughter. Not happening.
I haven't gotten to that yet. I've only done number 1.
Is that what you're saying, though? Is that you're saying that you're going to sit on the potty and actually use it, and that's going to be to demonstrate how she can use it, but you're going to be on the potty, not on a toilet?
Yeah. I mean, look, my daughter's seen me on a toilet, but I'm just saying I have also put it next to the car while she's sitting in her car seat. And I'll say, look, mommy's going. This is how, this is how easy it is. You just go and you have to go. And she is amused when she sees me using her potty after she
because
used it. We'll take turns.
It's funny to see that. I mean, okay, so here's what we do. You're 3, so you're going to have to learn before doing this. Make sure nobody's looking.
Make sure say that. Don't give them anything to be afraid of. Just go do your thing. Don't worry about who's looking, especially for 3-year-olds.
Well, that's a great motto to go through life. Don't worry about who's looking. And you know what? Again, there's a scenario where you don't go to the beach in yours. Now, again, I plan to go to the ocean, which I think was the best choice. Anyway, well, I am inspired.
Well, that was a fun topic, and we'll have to talk about outdoor schooling next time. Marshall Stevenson, thank you for joining me. As always a ton of laughs with you.
Thank you. I had a blast.
I'm Michelle Jerson, the Passport Mommy. With 25 years in the vacation rental business, Vrbo is the go-to for families who want to travel better together and reconnect with their loved ones. Every time you book with Vrbo, you get the entire vacation home to yourselves. You'll never have to share the space with other than the friends or family you're traveling with. That means you can enjoy the ample space, privacy, and amenities Vrbo offers while making memories together that last a lifetime. Whether you're looking for a beach house, lake house, ski chalet, or cabin in the woods, Vrbo has the perfect vacation home for your next getaway. I've used Vrbo to book my Florida getaway and my amazing Italy vacation a couple of years ago. We stayed in the most breathtaking of homes with really friendly and helpful owners who gave us great tips on what to see in the area. Need inspiration for your next family vacation? Just go to Vrbo.com or download the Vrbo app. But I'm warning you, it's really addicting. Again, just go to Vrbo.com or download the Vrbo app. So, when it comes to ancestries and figuring out our backgrounds, I'm really interested in that because my mom was adopted and we were, for the longest time, trying to figure out, well, what is our background? More importantly, what is our health background? And so today I'm thrilled to have with me Dr. Ron Park. He is the Executive Vice President of Health and DNA at Ancestry. And Dr. Park, I understand that Ancestry has something new called Ancestry Health, and it's a new testing option on the market. Tell me about that.
Yeah, we're super excited by this. This is an area where people are more concerned about their health than ever before. And we're now bringing Ancestry Health powered by next generation sequencing to consumers. And this is an opportunity to really bring the latest in DNA sequencing technology to consumers at an accessible price point. And by doing this, we're allowing consumers to have more information and more comprehensive genetic screening of commonly inherited health conditions, really than ever before at this price point. And, as you're saying, this is not only an era where people are more concerned about their health, but especially for those who may not know, who their parents or grandparents were. Right, this is the kind of information that's really helpful for people to understand their health better and to take care of themselves better and keep themselves well as long as possible.
Absolutely. So, how does the next generation sequencing work? What's the price point on it?
Next gen, maybe just a little history here. The technology that's been available to consumers for genetic testing for a long time was based on something called microarray technology that looked at specific spots in the DNA. Over the last several years, next generation sequencing technology has come along, and this allows us to really sequence the whole genome and really look very closely at specific areas of risk within one's DNA. And so, it's now gotten to a point where we think it can be done in a way that's accessible to consumers, which is why we're introducing Ancestry Health powered by next generation sequencing. And for those who are not already part of the Ancestry family, the price point will be $179. And for those who are part of the Ancestry family and have already submitted their DNA, it's simple to upgrade and to get the health reports, and that's for $99.
Wow, that's nothing. I mean, right, when it comes to figuring out your background and wanting to know your risk factors for certain things, because I feel it's important so you know what screenings you should maybe step up and do and be aware of.
Absolutely. And I really do this in two ways. Right. The first one is certainly if there is a health risk identified, then it's super important for you to know this so you can go to your physician and have the right discussion around your health risks and do everything you can to maintain yourself well. But the other way I would say, and I think you touched on this a little bit as well, this is an area where we're all concerned about our health. We're concerned about our ability to stay healthy and take care of our families, this is the kind of report where, well, actually, just as when you go to your doctor, sometimes you actually are happy to see that nothing was identified, right? Because that's reassuring. So I do think this is an area where something like this is super helpful to people, for those who are really worried about their health and their ability to take care of their family. And if that provides reassurance for some, because, well, we don't find increased genetic health risks in the reports, that's great. If we do find genetic health risks, then it helps people to do the right thing to take care of themselves and their families, which I think this is something that we can all agree is a good thing for all of us.
Absolutely. So where can people go for more information and to order the kits to get started?
Yep, it's super easy. Just go to ancestry.com/health and information on the product and next generation sequencing and the information this provides is all right there. And we hope that people will go and be just as excited about this as we are.
Yes, absolutely. I'm excited about it, Dr. Ron Park, because I'm always very interested. And I know, in a lot of places too, birth records are not even made public. So if you're adopted, you may not know your background at all, and you may not have access to those health records. So something like this, to be able to bring awareness to, like you said, things that you might need to just, hey, let me go get that screening for that because this does run in my DNA. So helpful to know. Thank you so much, Dr. Ron Park. I'm Michelle Jerson, the Passport Mommy.